It's good that we have pain. If you put your hand on a stove, it's good to have pain because you pull your hand away. Pain lets us know that there's a problem going on. Let's talk about some pains, though, that are very dangerous and require emergency treatment. Number one, let's think about the head. If you've got a banger of a headache, the worst headache that you've ever had, especially if it's a throbbing headache, and you have to close your eyes and clench down, you may be having an aneurysm that's getting ready to burst right there, and you must see your doctor immediately. That's the time, really, 911, go to the emergency room and tell them. That's the worst headache you've ever had, pain number one. Chest pain. If you've got a squeezing pressure chest pain and it's accompanied by people that are sweating and you look clammy, you may be having a heart attack. Chew on an aspirin. That will keep the blood clot in the heart from expanding. 911, get to the emergency room immediately. Pain number three, belly pain. If you've got a severe belly pain and when you push in on the stomach, it's hard as a rock, you may have had a ruptured viscus. Any part of the GI tract can rupture. If it's pounding and tearing, sometimes you've got a dissecting aneurysm. Don't play around with an appendix, that's the right lower quadrant, gallbladder, right upper quadrant. Don't play around with those pains. Get to medical attention immediately. Then we go down to the extremity. In your legs, calf pain. If one of your calves are red, hot, and swollen, you may be having phlebitis. You may be able to, if you don't get that looked at, you may get a blood clot that's thrown to the lungs. So a painful, hot, red leg has to be seen immediately by the doctor. And the other thing is way down at the bottom of the toes, peripheral neuropathy. If you've got numbness and pain and shooting pains, that may be the first sign that you get that you have diabetes. If you have diabetes, it's the most common cause of blindness, it's the most common cause of amputation, it's a common cause of heart disease. So if you've got any of those pains, they're there to warn you that you need to see your doctor immediately. Any pain that doesn't go away, talk to your doctor. He'll know how to ask you the right questions and take care of that pain, but those are danger pains that we just talked about.